A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. My name is Abbas Ali Mehman, and today my topic is about Ofloxacin drug, which is submitted to Dr. Shahana. Uh, basically, basically, Ofloxacin is a second generation 4-fluoroquinolone antibiotic, which is well tolerated by most of the patients. And the common adverse effects involves gastrointestinal system, central nervous system, hypersensitivity reaction, metabolic reaction, and anaphylactic reactions. जब भी क्लिनिकल ट्रायल्स करे गए उफ्लॉक्सासिन के तो 11% patients experiences the side effects, and out of only 4% relieved from the symptoms after discontinuation of the therapy. Serious and occasionally fatal hypersensitivity and anaphylactic reaction has been reported in the patient receiving ofloxacin. The reactions often occur following the first dose, like cardiovascular collapse, hypotension, seizure, loss of consciousness, tingling, angioedema, airway obstructions, dyspnea, urticaria, itching, and other serious skin reactions. The first step is immediate discontinuation of the drug. And the serious acute hypersensitivity reaction may require treatment with epinephrine and other resuscitative measures, including oxygen, intravenous fluid, corticosteroid, pressure sumines, and airway management as clinically indicated. As we know, ofloxacin antibiotic, so it is a bactericidal, and its mode of action depend on blocking of the bacterial DNA replication. How? By binding itself to an enzyme that is called DNA gyrase. DNA gyrase actually allows the untwisting required to replicate one DNA double helix into two. To be noted here that the drug has 100 times, yani ofloxacin has 100 times higher affinity for the bacterial DNA gyrase than for the mammalian. Ofloxacin is a broad spectrum antibiotic that is active against both gram-positive and the gram-negative bacteria. If we talk about the background of ofloxacin, it is a fluoroquinolone. It belongs to the class of fluoroquinolone and composed of two isomers known as levo and dextroisomers. जब हम लीवोफ्लॉक्सासिन की बात करते हैं तो it is isolated optically active levoisomers of the ofloxacin, and pharmacokinetic property of the levofloxacin permit dosing once daily as opposed to the ofloxacin, which is given twice a day. Efficacy which is superior to commonly used fluoroquinolones like ofloxacin and ciprofloxacin. And ofloxacin comes as a tablet to take by mouth. It is usually taken with or without food twice a day. So guys, let's talk about the case study. A 24-year-old female arrived in the emergency department with the complaints of the loose stool and the vomiting for 2 days. There was no history of breathing difficulty, rashes, and itching. Her examination showed normal vitals, pulse rate 74 ppm, blood pressure is 120 by 70 mm of the mercury, and chest bilateral clear and normal cardiac rhythms. Her complete hemogram, renal, and the liver function tests were normal. She didn't have any known past history of the allergic reactions to medicines or food, or history of any allergic condition like dermatitis or asthma. The subject is gender male, age 24, chief complaint loose stool and vomiting for 2 days. The vital signs: pulse rate 74 bpm, blood pressure 120 by 70 mm mercury, allergic condition like dermatitis or asthma, hypersensitivity reactions like angioedema. These are not seen. She was assessment करेंगे तो she was prescribed tablet that is ofloxacin 200 mg twice daily. And plan क्या हो सकता है कि ofloxacin भी दें. Also advised to take the oral fluid so that avoidance of the dehydration, and the patient took 2 tablets of ofloxacin. Frequency of the loose stools gradually decreases. So this is all about the ofloxacin mechanism, adverse effects, uses, pharmacokinetics, and including the case study. And thank you.